Hi friends, today we are going to be having a discussion of bleeding disorders. To understand the pathogenesis and the features of bleeding disorders, we need to just recap the process of the normal hemostasis first. So let us just recall the process of normal hemostasis. Whenever we have any kind of an injury taking place inside the body does not want to lose extra amount of blood. This loss of blood can be prevented by the process of hemostasis, and that is what is clearly understandable from the meaning of the word. So the blood is going to be static, or the blood should clot so that we do not lose extra amount of blood. Now in normal hemostasis, we have a very important role of three important components. The hemostasis is a process that is going to be contributed by, the first happens to be blood vessels. The second component in stopping the extra loss of blood happens to be the role of platelets. And the third important component of hemostasis happens to be the role of coagulation cascade. So how does each of these factors contributes to the process of hemostasis? When we look at the blood vessels, after any injury, there is going to be a reflex vasoconstriction of the blood vessels. This is usually due to the action of vasoconstrictor substances like endothelin. So if there is going to be a decrease in diameter of the blood vessels, there is going to be less loss of blood. The second component of hemostasis is provided by the platelets. What we understand is that the platelets are responsible for the formation of a structure that is known by the name of a temporary hemostatic plug. So there is going to be a weak clot which is going to be produced at the site of injury because of the platelet. Now we do not want to have a situation where a weak clot is being washed off by the flowing blood. So we need to provide strength to the clot. How can we provide strength to the clot? That is because of the activation of the coagulation cascade. So the coagulation cascade is going to be having an important role. It is responsible for the formation of a strong clot or a permanent hemostatic plug. Now we need to be familiar with the role of each of these components in slightly more details so as to have a better understanding of the bleeding disorders. So let us just recap the role of the platelets in the formation of temporary hemostatic plug. If this is how we are making a representation of a blood vessel, the blood vessel is going to be having the presence of endothelial cells. And let us say that there happens to be some kind of an injury or damage over here. Whenever there is going to be any damage at the level of the endothelial cells, this is going to be associated with an expression of a molecule that is known by the name of von Willebrand factor. Please recall something that we have discussed earlier. The endothelial cells contain special structures by the name of Weibel-Palade bodies. The Weibel-Palade bodies are a very rich source of a factor called as the von Willebrand factor. So whenever we have endothelial cell injury, the Weibel-Palade bodies are going to be having a release of von Willebrand factor, and this von Willebrand factor is going to appear on the surface of the endothelial cells. Now what will happen? Because of the expression of the von Willebrand factor, what we find is that the platelets which are moving in the circulation, These are the platelets. The platelets are having an expression of a molecule on their surface. This molecule is known by the name of glycoprotein 1b. So what we find is that the glycoprotein 1b of the platelets is going to interact with the von Willebrand factor. This kind of an interaction between the von Willebrand factor and glycoprotein 1b is responsible for causing the attachment of the platelets with the endothelial cells. When the platelets attach with the endothelial cells, this is a process which is called by the name of platelet adhesion. So to adhere with something means to attach with somebody or to bind with something. So platelets and endothelial cells attach with each other because of the interaction of glycoprotein 1b and von Willebrand factor. After this kind of an adhesion, the platelets are going to get activated. What is the meaning of the term activated? The platelets are actually example of cells which are going to be having a smooth surface and they are having a disc-like shape. Whenever there is a platelet activation, what we find is that there is going to be a change in the shape of the platelets, and so that is how I represent the activation. And the second thing that is going to be happening over here would be that the platelets are going to release their granules. So change or alteration in the shape of the platelets as well as degranulation of the platelets. Along with this degranulation, what would happen is that the platelets are responsible for causing an expression of a molecule on their surface. This molecule is known by the name of glycoprotein 2b. Why is that important? Just like you and me, whenever we have an emergency, we would like to call our friends. Over here for the platelets also, this is a kind of an emergency. There is a damage. So they need to plug the injury point or they need to stop the bleeding. So the platelets are going to call more of their friends so as to stop bleeding. What is therefore going to be happening over here is that additional number of platelets are going to be coming over here. And these platelets are going to be getting attached with the already pre-present platelets. So deliberately I have represented as in the form of the letter 2 just to help you remember and understand that this is glycoprotein 2b. What exactly is facilitating the interaction between the upcoming platelets and the already present platelets is the presence of a protein molecule over here. And this protein molecule over here that I am representing in the red color is a protein molecule that is known by the name of fibrinogen. So what do we understand? Initially, whenever there is an injury, the platelets are going to bind with the endothelial cells. This process is called as platelet adhesion. The molecules responsible for platelet adhesion are glycoprotein 1b and von Willebrand factor. The platelets subsequently undergo activation, which means that they are going to have a change in their shape as well as there is going to be degranulation. The third thing that we find is the platelets are going to call more of their friends for help, and these new platelets are going to attach with the already existing platelets with the help of two molecules, glycoprotein 2b and fibrinogen. This process in which the platelets are going to attach with each other by the interaction between glycoprotein 2b and fibrinogen is what is called by the name of platelet aggregation. So this process of platelet aggregation is now responsible for causing the formation of a temporary hemostatic plug. We therefore can understand that for the formation of a temporary hemostatic plug, there are three steps which were required. adhesion. The second was activation. Because of activation, more platelets were brought over here, platelet recruitment. And the third step that we find is platelet aggregation. In that sequence, 1, 2, and 3. Why do we talk about them? Because for each of these processes, we require special molecules. For platelet adhesion, we require a molecule called as glycoprotein 1b and von Willebrand factor. For the process of platelet activation, we require the degranulation of the platelet as well as release of certain factors like thromboxane A2, ADP. And when we talk about the process of platelet aggregation, the process of platelet aggregation actually requires the interaction between glycoprotein 2b and a molecule called by the name of fibrinogen. Please recall, this kind of a plot, this kind of a plug is going to be, or this kind of a clot is going to be weak in nature. So we have to provide strength to the clot. How will you provide strength to the clot? By the activation of the coagulation cascade. Recall the fact that whenever we are going to be having activation of the coagulation cascade, whether by the intrinsic pathway or whether by the extrinsic pathway, what does happen? In the common pathway, the final step is conversion of fibrinogen into fibrin. Why is that important? Fibrinogen is responsible for causing an interaction between two platelets, which is going to be a weak interaction. But when this fibrinogen gets converted into fibrin, it's an example of a strand-like molecule. So this is responsible for causing a stronger interaction or a stronger bond formation between the platelets. So the main role of the coagulation cascade is to convert the soluble protein by the name of fibrinogen into the insoluble protein responsible for providing strength to the clot, that is fibrin. And that is how the injury site is going to be having the formation of a clot, a strong clot after the activation of the coagulation cascade. Now, why do we need to be familiar with this kind of a concept? There are situations that we are going to be discussing in some time in bleeding disorders in which a person is going to be having normal platelet count, but still he or she would be having the chances of extra platelet bleeding. What does that mean? Person is having normal platelet count, still he is experiencing excessive bleeding, which is because of non-functioning platelet. Why will the platelets not function? The platelets are sometimes not going to function if there is any problem in either of the three steps that we have mentioned over here. So what we intend to say, there are going to be certain example of disorders which are called as functional platelet disorders, and that means that the person is going to be having increased bleeding tendency, which is seen in spite of the fact that the person is having a normal platelet count. Why is this thing going to take place? This can be taking place because of a defect in either the process of adhesion or a defect in the process of activation or a defect in the process of aggregation. So we just enumerate some of these important examples. Possibility number 1, person is having an example of a disorder which is characterized by adhesion defects. Adhesion defects are going to be characterized by either a malfunctioning of glycoprotein 1b, or there is going to be a malfunctioning of von Willebrand factor. The names that are given to these different disorders: if there is a person suffering from a defect because of glycoprotein 1b, this condition is known by the name of Bernard-Soulier syndrome. Bernard-Soulier syndrome or Bernard-Soulier disease. If we are talking about an example of a condition in which there is a deficiency of or non-functioning of the von Willebrand factor, this condition is called as von Willebrand disease. So that is the first group of disorders in which there is a problem in either of the molecules resulting in defective platelet adhesion, and therefore the patients are going to be having functional platelet disorder. Second situation can be a person is going to be having the process of inhibition of platelet activation. Classically, this is something which will help us understand the bridge in pharmacology. So if we are having a situation in which a person is taking certain kind of drugs, and these drugs, let us say, are responsible for inhibiting thromboxane A2, or they are responsible for inhibiting ADP, then these drugs are responsible for the non-attachment or the non-functionality of the platelet. Please recall, clinically extremely important drugs that are given to the patient sometimes: aspirin. So aspirin is an example of a non-steroidal anti-inflammatory drug. This drug is going to act by decreasing the production of thromboxane A2, because this is an example of a cyclooxygenase inhibitor. So if there is going to be less amount of thromboxane A2, logically speaking, the platelets are not going to perform their normal function. Similarly, if there is any drug which interferes with the activity of ADP, example of the drug would include a drug like clopidogrel. The person is again going to be having a situation where he or she is going to be having non-functional platelet. Talking about a third example of a disorder, the diseases which are characterized by a defect in platelet aggregation. When we talk about a defect in platelet aggregation, the persons could be having a problem in glycoprotein 2b functioning, or they could be having a problem in the functioning of fibrinogen. The name of the disease that is seen in a person which is because of a defect in glycoprotein 2b, this disease is known by the name of Glanzmann's disease. Glanzmann's disease. On the other hand, if there is an absence of fibrinogen, or there is a decrease in the concentration of fibrinogen in a person, the platelets cannot aggregate properly. So this kind of a condition is called by the name of hypofibrogenemia. As we have talked about earlier, hypo means less, fibrinogen means fibrinogen, in the emia, in the blood. So if a person is going to be having less amount of fibrinogen in the blood, this person is going to be having a defect in the process of platelet aggregation. So these are the 4 or 5 situations where, in spite of a normal platelet count, the platelets cannot function normally, and therefore these are called as functional platelet disorders. Additional facts that we need to remember for cracking questions that are asked in the exams. Sometimes people have a confusion in remembering which particular glycoprotein is associated with which particular disease. So when we are encountering this kind of a problem, the easiest way out would be just go back to our preschool days. What we were taught in the preschool days, in the numerical order, 1 always comes before 2. And if we just remember our alphabet, what we find is B always comes before G. So what does that mean? Whenever we are going to be having a problem with glycoprotein 1B, the disease is Bernard-Soulier disease. And if we are talking about a problem with glycoprotein 2B, so 2 comes after 1, and similarly G would come after B. Glanzmann's disease. The second thing that we need to be familiar with would be in their physiological role as well. The first example of a molecule, that is glycoprotein 1B, is responsible for the process of platelet adhesion, and glycoprotein 2B is what is required for the process of platelet aggregation. So even over here we understand and quite easily remember D will come before G. So first adhesion takes place, then aggregation takes place. So therefore the individual roles of glycoprotein 1B and glycoprotein 2B. A very high concept that we need to be familiar with would be, sometimes the questions in the boards make a mention of the fact that the patients were having a functional platelet disorder and the patients were having a defect in glycoprotein. They do not mention which glycoprotein. One of the characteristic findings that we have in a patient suffering from Bernard-Soulier disease, that if you look at the peripheral smear of these patients, the patients are going to be having big sized platelets. Peripheral smear in patients suffering from Bernard-Soulier disease are going to be having giant platelets. So big size platelets, easily remembered with the name of the disease. Bernard-Soulier disease. Patients have big sized platelets in the peripheral circulation. This is what we are supposed to be familiar with so far as the examples of the two important disorders are concerned with respect to the glycoprotein. So in total, what did we discuss? We talked about in total 5 important examples of disorders which are characterized as the functional platelet disorders. After knowing about this kind of an idea, we need to be familiar with the basics of the bleeding disorders. Please recall the concept. Whenever we are talking about the platelet disorders, or platelet defect, patients are usually going to be having an increase in the value of bleeding time. What is bleeding time? You actually make a venipuncture or you put a cut with a sharp object in the skin of a person. Look at the time till which the blood is going to ooze out. Note down the time when the bleeding stops. So think about it physiologically. If you make a cut and after some time the bleeding is going to stop. Why does the bleeding stop after some time? Because of temporary hemostatic plug. So the time taken for the bleeding to stop, that is what is called as bleeding time, which means the bleeding time is an indicator of the platelet functioning. On the other hand, whenever we are talking about any kind of a coagulation factor problem, we discussed earlier that clotting factor problems are picked up with the help of two important parameters, prothrombin time and activated partial thromboplastin time. Please recall that whenever we are talking about the prothrombin time, that is an indicator for the functioning of which pathway of the coagulation cascade? Yes, this is responsible for the functioning of the smaller pathway. So smaller name, PT is a smaller name in comparison to APTT. Therefore, PT is an indicator for the normal functioning of the extrinsic pathway. On the other hand, longer name, longer pathway. APTT is a longer name than PT. So this is an indicator for the normal functioning of the intrinsic pathway. Why is that important? Whenever a patient is going to be having a bleeding disorder and the patient presents to you clinically, as a matter of fact, we would always go in for these kind of investigations in the patients. So we will always go in for something like bleeding time, prothrombin time and APTT so as to pick up the kind of a defect which the patient is likely to be suffering from. We therefore now are going to be having a discussion about the bleeding disorders. So how do we talk about bleeding disorders? When we talk about bleeding disorders, what we understand is that bleeding disorders can be of two important subtypes. They can either be because of a platelet problem or they can be because of the clotting factor problems. How would you as a physician distinguish between these two? Whenever a patient is going to be having platelet problem, most of these patients are going to be presenting with superficial bleeding. So patients are going to be having superficial skin or superficial mucosal bleeding. Superficial bleeds would be seen either in the skin or in the mucosa. What are the example of these kind of bleed? In the skin, what the patients are going to be having would be something like petechiae, or the patients are going to be having purpura. So petechiae means that the patient is having a skin bleeding which is going to be less than 1 millimeter in size. If it is 1 to 2 millimeters, that is called as purpura. So small one is petechiae, the slightly bigger one is purpura. And if you're going to be having a still bigger one, that is what is called as ecchymosis. So petechiae, purpura are classically what we find in case of platelet disorders. In case of mucosal bleeding, what we find in these patients is going to be the presence of something like hematuria, or the patients could be having something like excessive menstrual loss of the blood, or the patients could be having involvement of the gum mucosa, might as well you find patients are going to be having development of melena. What is melena? It's an example of a bleeding that is taking place from the gastrointestinal mucosa. So either you are going to be having a situation in which a person is going to be having skin bleeding in the form of PTK purpura, or you are going to be having mucosal bleeding in platelet disorders like the involvement of the urogenital mucosa, hematuria, involvement of excessive menses or menorrhagia in a female patient, gum bleeding, or there is going to be involvement of the GI mucosa in the form of melena. So whenever we have PTK or purpura or mucosal bleeding, think in terms of platelet disorder. On the other hand, whenever we are talking about coagulation defects are classically characterized by deep tissue bleeding. What is the meaning of deep tissue bleeding? Patients are going to be having a bleeding either in their joints, or patients are going to be having a bleed in their muscles. So whenever we have a situation in which a person is going to be having the presence of deep tissue bleeding inside the joints or the muscles, if it is a joint bleeding, that is called by the name of haemostasis. If it is a muscle bleed, that is called by the name of hematoma formation. So the name itself gives us a hint. Heme is obviously bleeding. Arthrosis refers to the joint. So hemarthrosis characterized by the bleeding in the joint, and hematoma formation, collection or pooling of blood, usually whenever there is going to be a muscle bleeding. So nature of bleeding in a presenting situation is the first hint what is the likely disorder that a patient is going to be suffering from. The second thing that we understand is that whenever we are talking about platelet disorders, most of these patients are going to be having spontaneous onset of bleeding. On the other hand, whenever we are talking about hemarthrosis or hematoma formation, patients are usually going to be having a history of some kind of a trauma. So think in terms of a patient who is presenting to you with bleeding episode. If you are having PTK, purpura, gum bleeding, mucosal bleeding in the form of menorrhagia or melena, it's a platelet problem. If you have a patient who is going to be having the bleeding in the joint or in the muscle with a history of an injury or a history of trauma, think in terms of coagulation factor defect. How do we distinguish between these two conditions? With the simple fact, any patient who is coming to us with a bleeding disorder, we would carry out the three important investigations that I shared with you earlier. If my patient is going to be having a platelet problem, then what I will find in the patient is elevation in the value of bleeding time. On the other hand, if my patient is having a coagulation factor problem, the patients are going to be having a disturbance of either the PT or the APTT value. So this is one of the very important ways by which we distinguish